Hi everybody, it's Dr. Pearlman, special guest, nurse practitioner Jen. This angle, first time in a while, might even be like 4 years since we've done a video like this. But here's what we're gonna do today. We're gonna talk about common questions that people ask their providers about chiropractic and giving you the truth, the inside truth here at Paramount Chiropractic and Wellness. So go.
What can patients expect during their first visit to a chiropractor?
So people, I guess, ask Jen and other providers where she works, what can they expect at their first visit at a chiropractor? And the first thing I will say is it should be inviting, it should be warm, it should not be ambiguous, right? One of the rules that we live by here and in our lives is no ambiguity. We don't want it to be something that's like so uncertain and wondering, or left to wonder. So what I mean by that is there should be intake paperwork because there's liability. There's legal things that people need to have I's dotted and T's crossed. There should be an expectation of a proper evaluation and consultation to talk about why they're there. It's not just going straight into like touching the body, starting to adjust everybody and then give them a care plan. We've really got to understand the nature of the injury and then be able to evaluate it properly. And then also explain and educate what chiropractic is without like losing them into the neuroscience. And certainly if someone is acute enough, they should absolutely be adjusted on the first day, in my humble opinion, because in the words of Braveheart, or somebody in the movie Braveheart once said, we didn't get all dressed up for nothing.
Another one is a huge one is what conditions do chiropractors treat? Yes.
Conditions that chiropractors treat. I hate to break it to everybody out there, but chiropractors treat no conditions. We treat nothing. We are the conduit between the body being self-healing, self-regulating, and I know some of you evidence-based people and some of you mechanistic people, and believe me, I'm nor vitalistic nor mechanistic, but I can tell you that we don't treat anything. We are the conduit to letting the interference, whatever that interference is, could be serious injury, could be disc herniation, to get out of the way for the body to self-heal and self-regulate. So we care for many conditions, we provide for many conditions, but to say we treat, I'll give you this. We might treat discogenic and like stenosis and or spinal related conditions in some manner with lots of different techniques, but when it comes to the chiropractic adjustment, we can care for just about any symptomology in the body. And what I mean by that is, and I'm not saying we cure everything, so also out there, we don't cure anything. We don't treat anything. We simply address the nervous system function through the joints that are dysfunctional, a segment at a time, so to speak, in an ideal world, and let the body self-heal, self-regulate, and a lot of times symptoms seem to improve.
Another really important one, or I think a lot of people ask because they're very scared, is chiropractic safe?
Chiropractic is so safe that our liability insurance or malpractice insurance is like, I don't know, probably like 100-fold less than a spinal surgeon. It is generally and genuinely a very safe modality, a safe practice. The amount of actual, devastating injuries that come from chiropractic a year throughout like America, North America, Latin America, for all I know, has got to be next to nothing. And yes, serious injuries can occur, which is why evaluation and proper imaging and competent providers in any field are necessary, because if you miss something when a patient is suffering with a symptom, and by the way, patient means to suffer. So if there's a patient that has something that's being in an evaluation missed that is life-threatening, without question, they could have an alternate reaction in a bad way, and that would be something problematic to say the least. So chiropractic is very safe, and the worst that could happen that I've seen, and I've given to my patients, minor strains, minor sprains in areas of ligaments and tendons that happen when you are doing a high velocity, low amplitude thrust.
Another one that comes up often is once I go, I'm always gonna have to go. How many times do I need treatment?
So chiropractic has this reputation for whatever reason, like once you go, you always have to go, or that's what people are kind of think because of what they're told or why they're always going to the chiropractor. So I hate to again break it to everybody. Again, I'm telling the truth here. Chiropractic is a way of life. Chiropractic is this. Are you ready? The way I tell all my patients. She's a chiropractic patient for life.
Yes.
A little bit more convenient for her to get it than somebody who maybe doesn't live with a chiropractor. But the point I'm making is, she's a Lamborghini. I'm a mechanic. When I go get chiropractic, I'm a Lamborghini. My chiropractor's a mechanic. The body needs that kind of attention. Some days it's the tires. Some days it's the oil. Some days it's the spark plugs. Other days it's an alternator. Sometimes it might just be the battery. That is our body. I hate to also now then compare it to like a machine, but in a lot of ways we are very mechanistic and we need that maintenance. And that maintenance is a lifelong process of getting checked and applying adjustments where needed.
Now, when they go, another question that kind of brings up is, do I need x-rays?
95% of the time, I would say that everyone needs an x-ray, and here's why. Say you're maybe 10 years or younger, and there's no suspected scoliosis or acute injury. There's probably not going to be too much of a reason to have to get an x-ray. To be honest, I would say even at that age, there's probably not much of a need to do too much structural, high velocity, low amplitude thrusting in and around certain regions. But at the same time, once you're, say, adolescent up until old age, there are too many reasons you want to take an x-ray to catch anything that's a red flag. And again, in my office, and in my practice, and a lot of my mentors' practices, we don't take chances of missing things that need urgent, emergent care. So we're always going to make sure that we have our blueprint of what the x-ray looks like. And the last thing I'll say about having an x-ray, and obviously we don't x-ray pregnant women, and obviously we don't take additional x-rays that would be, too much exposure to radiation, regardless of what anyone thought of that. But we just want to be responsible, and we always want to make sure we're seeing what we're pushing on. And I will say one last thing is, we always want to have an AP, that's an anterior to posterior, front to back x-ray in the office here, because we want to see the contour of the spine. And you always want to be adjusting the spine to neutral. The brain loves neutral. You don't want to keep pushing it out of alignment, because when you push out of alignment, the brain perceives it as not neutral, and that is very bad input to the body.
Now, I know what I would say to this question, but what would you say to a patient, like, when they ask, who do you think can utilize chiropractic care?
So I know why you're giggling, and I know what you're going to say, and that's everyone.
Everyone with a spine.
If you have a spine, you can utilize chiropractic care. But I'm going to nuance this answer a little bit, because I understand that when it's a chiropractor making a video about who can benefit from chiropractic, we come up here and we're like, everyone. If you have acute spinal pain that wasn't so severe that you need to go to the emergency room, say you pulled on a root while you're gardening, say you were shoveling down in the Northeast, and you felt that tweak in the back, say you're at the gym with your buddies here in Texas, and you pulled that the barbell off the ground, you felt that pop in your back, you sent to the floor, you don't need to go to the ER. You need to go to your chiropractor. You need to get an x-ray. You need to get proper evaluation. And after your proper evaluation, your x-ray, you need to start getting adjusted. We'll just kind of leave it at that. Chiropractic does shine in those circumstances, which is why we're recognized by these third-party payers, if you will, in post-car accidents to kind of structurally work with some spinal deficiencies, if you will. Do I think that headaches, migraine, vestibular issues, and dizziness, vertigo, probably some upper GI and lower GI symptoms, would they benefit from chiropractic? Because of what we mentioned early in the video is all the spinal nerves and the spinal nerve roots that innervate all the muscles also innervate all the glands and organs as well, and sometimes can help ease the tension, taking something from a sympathetic state and putting to a parasympathetic state, and vice versa, through chiropractic care. So there's a lot of treatments, but the people that are in acute spinal pain, locked neck, locked back, torticollis, discogenic in nature, herniated or bulged disc, radiculopathy down the arms and legs, is definitely something you want to, at least up from a conservative measure, see a chiropractor.
Okay. How about if you say, what age should chiropractic start?
The age chiropractic should start from the first breath a child takes. And again, I will nuance this answer by saying, if a child does not seem to be in distress or showing signs of dysfunction, I do not think they need to be going to a chiropractor for no reason. I think that it should be obvious to the parent that they are picking up signals from their child that they need to get checked. And we are innately primitive, smart human beings that can pick up on cues, and it's amazing how fast the child will react to adjustments. And also, if you're 100 years old and you felt pain that you haven't felt before, and then maybe you decide you want to go to a medical doctor first, and they give you the screenings and they do all the tests and nothing bad is there, they should go to a chiropractor as well. I hope that answered that question.
It did, kind of. I'm just going to dive a little deeper.
Yeah, please.
What kinds of things should a parent seek a chiropractic for help for their children or child?
I think that if a baby is colicky because they are uncomfortable or they're showing you that they're not able to use the bathroom efficiently, okay. They're backed up. Also, if they have too much diarrhea, food is going through them too fast. If they're having trouble sleeping and they seem to be just overall uncomfortable, I think that is a great sign when they're that little and can't tell you what's wrong or point to what's wrong. You should get them checked by the trusted, recommended, referred chiropractor.
And then one other question, I'm going to kind of go on the same side, but I'm going to look at children and adults. Mm-hmm. A lot of the question, it's going to be very painful. Is it painful? Especially the loud noises. I think patients have this very scary thought in their head because of the loud noise that makes. What can you say to that?
Do you think it's painful?
I don't think it's painful. I think it's magnificent.
And have you, but here, we'll tell full transparency, have you ever been hurt by an adjustment?
I have.
Yeah.
I have.
And so let's just say 95% of the time it's comfortable, it's effective, it feels good.
Yeah.
And then about 5% of the time, we're talking about like over the lifetime, there's a little sprain, a little strain that goes along with it. If there's a child in front of me, they're never going to feel pain. And I just say that because I'm never adjusting a child and their pliable, flexible body and joints. I'm never going to be putting in the force that I put in with like a 45 to 55-year-old person who has arthritis and you know, we've got, you know, one chance to get the perfect amount of millimeters off of the pressure of the disc to make a correction. When they're that young, no, that's fine. When they're that young, it's very easy to just use a push and things get adjusted. Nobody's here.
Oh, really?
Yeah.
Another question I have, or I think there's a lot of misconception out there, is that there are many different types of chiropractors. Can you elaborate on it?
So let's do this one, hopefully in closing, because we do probably have someone coming in any minute. But the question is that there's a lot of different type of chiropractors, right? So it's like this. There's a lot of techniques. We learn a lot of techniques in school. Most chiropractors pick something that aligns with their beliefs, it aligns with their personal experiences, their personal biases, and those techniques will work for, you know, various subsets of people. Some people like me really like a firm, fast, deep adjustment where we know we felt something move. Other people want very, very, very light, and as long as they feel the overpressure and they feel the effectiveness, then that's for them. So there's many techniques.
Now, how would a patient know
who's for them?
Who's for them, exactly.
That is honestly an answer of, usually say you're watching YouTube this day and age, you'll feel like you resonate with somebody and you'll feel like, ooh, I need that. That's one great way to kind of lead you down the right direction. And then the last, or the other thing I'll say to that is trial and error, trials of care. Going to chiropractors till you figure out like, wow, I needed that. And that's usually the person that you end up deciding that's your chiropractor.
Another thing I think a lot of patients ask is, how fast will I feel better?
How fast you'll feel better is completely dependent on the type of injury you have. and why you've had those, not just the injury, but the symptoms. And so it could be anything from a day of, oh my God, it was a miracle, all my symptoms went away, to 2 weeks of adjusting, leading through extensive rehab, weeks to months.
What about aftercare? So after my first visit, what should I do to make sure the adjustment holds, or make sure that my body innately knows what to do?
Getting an adjustment for wellness is very different than getting an adjustment for an acute herniated disc or very severe stenosis in the bottom of the spine. So just using those two examples, getting an adjustment because you have migraines is going to be completely different than getting an adjustment for your lower back because you can't get out of bed in the morning. Both of those are case dependent and they're completely different, and every case is so unique to that person. And that's really what someone should look for in a chiropractor, someone who knows how to manage their symptoms, manage their case, manage their body, their Lamborghini.
Okay.
Yeah.
One of the most important ones, I think, and I think one that you hear often, is do they take insurance?
Well, listen, we got to wrap up this video, but last is like this. Like, if people ask about insurance for chiropractic, I can make a whole separate video on that, and I think I will. But there are pros and cons of chiropractors taking your insurance, and all I'll say right now is reimbursements are very small, but nationwide for chiropractic care. The average reimbursement is probably between $30 and $35 on a spectrum, right? And because of it being that low, chiropractors have sort of made it a point that they probably can't provide enough care just billing insurance, and the insurance won't pay for years worth of chiropractic. But again, it's another video, and it's just a thing that it's like, we don't take insurance. It doesn't mean that like somebody else who doesn't do a good job. It's just another conversation.
Perfect.
So, yeah.
I think you got it, my love.
Well,
I think you did most of the questions that a lot of my patients have.
Well, thank you, Jen. Nice to have you on the podcast, honey.
Thanks. Thank you. Bye, everyone.